Hey guys, welcome back to my channel. So today's video is going to be my 6-month new grad ER nurse update. I mean, it has been, I personally cannot believe it's been that long. It's like literally insane. And I have not spoken to you guys in so long. And I miss you guys so much. But y'all, like, I have been going through so many changes and so fast. I don't even feel like I had the time to sit down and process what I've been going through. And I've been in such like this little like new nurse funk, and I just feel like I need to snap myself out of it. And I really couldn't sit here and talk to you guys feeling like just and I just can't be fake on here for you guys. I really can't. I'm just not that YouTuber. I can't. So I just was like, you know what, let me just get myself together. But your girl is back. Your girl is back. I'm here to tell you guys the tea, everything that's been going on with me, how it's been as a new grad nurse, how it's been working in the ER in itself, and just like everything that's kind of been going on. So if you want to hear about what's been going on with your girl, which I hope you do because I've missed you guys, please stay tuned for the video. And if you haven't done so already, pull up a chair, stay a while, join the Graceful Fam, give this video a thumbs up, and comment down below. I have truly missed you guys, and I want to see you guys comment. I have been reading all of you guys' DMs and all of you guys' emails, and I try to get back to as much of them as I can, but I truly love seeing them. I recognize all the names that people that have messaged me on a consistent basis. Some of y'all like, girl, where you been at? What you been doing? Hello? I haven't seen you. And rightfully so. Rightfully so. I love when y'all like, girl, when you coming back? Like, what's up? Appreciate that because it lets me know like, oh my gosh, I need to get myself together. I need to keep pushing. So while we're at it, let's get into the video. First things first, for those of you guys who do not know, I am a new grad registered nurse that is currently working in the emergency room. I started working at the end of March. Now going on last year, and yeah, like it's about to be March now. We're like in December. Time is flying by so freaking fast. So I am going to be 1 full year March 28th. So time is flying by really fast. So with that being said, I have felt like my whole nursing journey has just been in a pressure cooker. Like everything has just been happening so fast, so quick, and a lot of information all at once. And I kind of felt like, oh my gosh, like, do I even have space to absorb all of this information, is how I've been feeling. So I started, so first and foremost, I took my NCLEX March 2nd or 4th. If you guys haven't seen any of my NCLEX videos, please feel free to check them out. I'm going to tag them somewhere here. But after I passed my NCLEX, I pretty much was hired for this job a week or so after. And then I started at the end of that month. So everything happened like really fast. And I kind of just felt like I didn't really have a break to kind of sit down and like just process anything. So I kind of just literally went right into work, because while studying for the NCLEX, I was also externing. So I didn't really have a time to really sit down and process things, but I kind of just felt like I needed to get out there. I needed to start working. So the first month that I was hired is pretty much, you're in the classroom, you're relearning everything that you learned in nursing school. Not everything, but kind of like the basics, like how to start a blood transfusion and how to make a bed, like just the basics. That's kind of what we went over, and skills and how to set up IV tubing and just things that you know, but you kind of need a refresher and you don't want to feel dumb on the unit. So they kind of go over it for you, how to insert an IV, which they don't teach in school, which I don't know why, but that's another story. But yeah, like as an ER nurse, literally I put in like, I feel like I pop 50 IVs a day. Like everyone that comes into the ER needs an IV, whether it's blood draw, IV fluids, whatever. Like when someone doesn't need an IV, I'm like, oh wow, this is great. So yeah, so there's that. So all that to say, the first 4 weeks, I would say, because I started at the end of March, so technically April. So by the end of April, I would have been done with kind of my classroom skills. I also did a tele class where they taught us how to read EKG strips. You learn that in school, but they kind of go a little bit more in depth in this class, just kind of to know what are the lethal heart rhythms, what are shockable, what are some things that you need to do immediately once you see some of these type of rhythms that are lethal. So things like that. So did that class, passed that, took that test. I documented that for you guys, so check that video out as well. And yeah, so after that, it is now May, right? So now I immediately am put on the floor, and now my orientation and my, like, I'm going to be paired with my preceptor at this point. So, long story short, I pretty much was an extern at the very same emergency room. So as a nurse extern, I didn't ask to be put in the emergency room. They kind of put me in the emergency room. And my role as a nurse extern it really wasn't any nursing skills. It really was just kind of like, like nurse's aid work, like literally helping make the beds, helping changing patients, turning patients, getting things for them and things like that. And the benefit was just being able to make connections and watching some nurses, but the ER was so busy that if you had a nice enough nurse to help you, they did. If they didn't, they didn't. So I did have, I remember one nurse was nice enough to kind of like take me under her wing and help. And at the time, I didn't know if I wanted to work in the ER or at that hospital to begin with. But long story short, my first day of orientation, my preceptor actually was sick that day, my actual preceptor, and she saw that they were looking for a preceptor for me, and the same nurse that remembered me from when I was an extern. And she was like, "Oh, I'll take you. It's fine." She took me under her wing, and she normally doesn't precept anyone. So the fact that she wanted to take me under her wing, I was like, oh my gosh, like she is an angel. Like my preceptor was the best. Like I'll get into that, but she was like amazing. So anyway, I start my orientation like beginning of May, and I'm not gonna lie to you, your girl was nervous. Your girl was nervous. Okay. I feel like I was nervous because part of my orientation, even in the classroom, was geared more towards med surg and not ER. ER is so specific and it's like a different world. Any specialty is different from your generic med surg. Yes, the foundation of nursing is all the same across the board. However, certain specialties, like same thing, like labor and delivery, yes, you have your foundations of nursing, but it's labor and delivery. It's a completely different world. Things are just completely different. I feel like it's the same for ICU. I feel like it's the same for ER, critical care, any type of different specialty, I feel like, or oncology, dialysis. They're all just, they have their own niche, and you have to learn not only the foundation of nursing, but also their specialty. So I felt like I had a lot to learn. I didn't know how to be a nurse, and now I have to learn how to not only be a nurse, but then be an ER nurse at that. So it was just like, okay. I just felt like I was like, oh, what is going on? So yeah, I feel like I hit the ground running. During orientation, my preceptor knew, like, I literally knew nothing. So definitely started from scratch, from the foundations. The ER is broken in two different sides. So there are like the med surg sides of the ER, where you have those people who are coming with lower acuity. For those who don't know the ranking, and you learn this in nursing school, there's different rankings, and we have 5 in the ER. So your level 5 is kind of like your fast track, your urgent care, maybe need stitches removed, maybe just will get a Tylenol, something that doesn't require any blood draw, something in and out, and it's called like fast track. So that's your level 5. Same thing with your level 4. Maybe they twisted their ankle, just need an ACE bandage, or their knee just probably need x-ray and things like that, and then they'll be on their way. But when you have your level 3s, then you're thinking more of like maybe abdominal pain. They're probably going to need a CT, they're probably going to need blood work, they're probably going to need an x-ray and things like that. When you are going into now your level 1s and your level 2s, you're thinking about cardiac arrest, you're thinking about stroke, you're thinking could be motor vehicle accident. It could be a lot of things. That could be your level 1 or 2. Level 1, it just kind of depends. Maybe someone was stabbed in this area. If they were stabbed lower, maybe that's a level 2. Our level 2s are like elderly women who may have, not women, but the elderly that may have fallen and they're on blood thinners. So that is a level 2 trauma for us in our ER. So things like that. So it's broken down, but they pretty much start us off on the med-surg sides of the ED. We call them the med-surg. They have different names, but for you guys, I'm just saying it's like the med-surg side because they're lower acuity. You're dealing with like your fast track patients, your abdominal pains, and maybe nausea, vomiting, dizziness, things like that. Things that aren't urgent, but they do need attention. So we started there for a few weeks, just kind of getting my feet wet. And the ER is like just so different. You even in school, you know nothing about the ER process. You don't even have clinicals in the ER. So with no clinical in the ER, I I didn't know what to expect. I didn't know what to expect. And even me being an extern in that same ER, I still was in for a ride. So if you see me looking over here, I'm just looking at my notes so I can get everything together. But yeah, like I really just felt like my process altogether was a little bit overwhelming, was a little bit quicker than what I had anticipated. And looking back, I'm still grateful for what it taught me, as far as realizing that I'm a lot stronger than what I thought, and I can handle a lot more than what I give myself credit for. And but it was a lot. It was a lot. Also, wanted to let you guys know, like the hospital that I'm in, or the ER specifically, is a level 1 trauma center. So like most of my anxiety is like, yes, being a new nurse, yes, being in the ER, a specialty that one I didn't even know, or I never saw myself in the ER because I never qualified myself to even be smart enough to be in the ER, or like, I know, I just felt like, who am I to think that I can qualify for the ICU or the ER or any of these places? I didn't even know that that's where I would end up or anything. But I'm so grateful. And looking back, everything happens for a reason. But like my nerves was mainly just because like this is a level 1 trauma center. They get everything. It's rare that they don't take any patients. Like the sickest of sickest people come to the ER, and it's like crazy. So that was like a lot of my nerves too, just kind of knowing what to do. And they pride themselves on how fast the ER moves and things like that for certain protocols like stroke and things like that. So I was just like really, really nervous. So I get a lot of questions about whether I was in a nurse residency program or not. So I actually was not. So I was not in a nurse residency program. My orientation altogether was about like 10 weeks, like less than 10 weeks, honestly. So that's like not much compared to some residency programs that are a year, some even orientation for like critical care or ICU is like 6 months. So mine was like fairly short. And yeah, I'm just going to push that to the side. But regardless, it still showed me how strong I was on the end of it. And kind of like, you know, when you're getting hired and there's staffing is an issue, and they just kind of need staff, like a lot of things just kind of probably get expedited. But yeah, I just kind of in the moment just felt overwhelmed by it. I really did. I'll be honest with you guys. But a residency program, for those that don't know, is kind of like it's like a program that assists and helps, kind of supports new nurses as they transition from school to new RN. And that kind of helps because school and real life nursing kind of really is night and day. So having that support and that transition can be very helpful, especially just like knowing that other nurses there are like, you know, going through the same thing. So if you are interested in nursing residency, feel free to do that research on your own and look into hospitals that cater towards nursing residency and what it would take to get into one, because some places have GPA requirements and things like that. I didn't really care too much either way for nursing residency or not. If I got one, I got one. If I didn't, I didn't. But my best friend is in a nursing residency, so if you guys want to know like a little bit more about that, I can have her on or just ask her for you guys. So when I hit the ground running after being on orientation in the classroom for the first few weeks, I met with my preceptor. She's actually a nurse practitioner, so she doesn't work there anymore, but she just was everything I could have ever prayed for, literally. So her shift was 11 to 11, and the ED has different shifts besides just the 7 p.m. to 7 a.m. So they also have evenings, which is 11 a.m. to 11 p.m. or 3 p.m. to 3 a.m., which nobody really likes, and people do it, but we don't have too many in our ED. And of course, like the day and night shift. So I currently work night shift. So while precepting on 11 to 11 shift with my preceptor, I just felt like I learned a lot. I loved how she taught me. She really made me think and understand why I was doing things. Always would ask me why I'm doing it. Do I understand why? How to move more strategic when you have an ED and you have like 9 patients. It's like, you know, unfortunately you can't spend all day with this one patient. You got to make sure you go in, get what you need to do, get it done, get out, and move on to the next, and kind of keep doing that process over and over. You don't always have that many patients. Sometimes the ED could be slow and you can have 2 patients, you can have 1, you can have none. There's been days where for hours I didn't have any patients because they're just low patient acuity that day. And then there's times where I look at the board and I see my name next to like 9-10 people at the time. Sometimes, you know, that just happens with the ED. You can't turn patients away, and you kind of just have to do one thing at a time. Literally, don't get overwhelmed. Do one patient at a time, and then kind of go from there. So always speak up for yourself. Don't be afraid to let your management or your nurse educator know that, you know, I think I need a little bit more time. After I was on my own, I think like the real work began, and I always felt comfortable knowing that like my preceptor at the time, even though I worked nights, she worked 11 to 11. So when I came in at 7 up until 11, at least I felt like I still had like my guardian angel, and whatever went wrong, if I felt like I had a question, no matter where she was in the ED, she would be willing to answer. She's like, even if, you know, I'm not here, you can always text me and things like that. So I always just felt like that support from her, and I pray and hope that, you know, if you're watching this video, if you're going into this journey, that you have that like preceptor or that kind of like nurse guardian that helps you. I really don't like the concept of nurses eat their young. Like, it's so not beneficial. Everyone was a new nurse at one point, so when people act like they weren't there, it really like grinds my gears. Like, I really don't like that bullying mentality. I hope to be half the nurse that she was, and to pass that on to someone else who needs the help, and to kind of help with that transition, because that can make or break a nurse's experience. Like, someone being mean to you when you first start a new job can make you feel like, I don't even want to work here anymore, or do I even want to be a nurse? So it's like, I don't have that experience. I'm thankful. I prayed for that. Like, I just am so happy that everything played the way that it did, and I feel like I have like a lifelong mentor because of this experience. So yeah, so guys, I don't want to drag this video or talk too much, but as of right now, I noticed that I have been put on the more acute critical side of the ED a lot more. I feel like, you know, my charges have had a lot more confidence. I feel like there was a point in time where when I first was on my own, I did start on the med surg side of the EDs, which were like lower acuity, your abdominal pain, your nausea, vomiting, dizziness, things like that. And that was helpful because I felt like I still needed to learn the foundation of nursing and just how to be a nurse, how to communicate with patients, and just overall, I feel like I was good with communicating with patients anyway, but just like interacting with like everyone else and how things work and who to call and pharmacy and the lab and like everything, and just practicing everything like IVs and stuff. And y'all, like, if you're an ER nurse, you put in IVs like this, and I feel like now like I'm pretty good. In the beginning I was a little rocky, but I feel like I'm pretty good now. Like, I'm pretty good now. I'm not nervous with putting in IVs. Like, I'm pretty confident. I go in confident, and yeah, like, I'll get it hand AC here. I've looked here. I've got one. No, not here. I've got one here before if they really don't have, or dialysis patients or anything like that. And if you can't get it, that's fine. Tell the doctor and they'll do sono, or you can use a vein finder or whatever. But that's not the end of the world. But yeah, I'm just getting more confident in my skills day by day. I just got my TNCC, so I feel like they are now going to be throwing me more into trauma, which is like another level, and like triaging, that's another level. But honestly, guys, I'm just taking it day by day. Like, getting adjusted to night shift hasn't been too hard, but it definitely is like your lifestyle is just different. So I don't find myself at work like nodding off or anything, because I just sleep during the day. I have my blackout curtains, I have my earplugs, like I'll do a video on that as well. It's more so just like lifestyle, like knowing that everyone is while you're sleeping, everyone is awake, and like while everyone's sleeping, you're awake. It's just kind of things like that. But if you want, I'll do a video on that. And yeah, guys, I'm really trying not to talk you guys ears off, but it's been 6 months. So much stuff has happened. But either way, I find myself each day getting more and more confident. I was extremely anxious, extremely nervous, just doubtful in my skills, felt like I was moving slow. But I feel like I was always told like that's normal. Speed will come with time. And felt like I was comparing myself to my preceptor, who just knew what to do, and she would just move with such swiftness and just whatever. And then she would always remind me, she's like, Ashley, this is me like years in the game. Like, you can't compare yourself to anyone with years in the game thinking that you'll know. She's like, when I started, I didn't know anything and I moved just like you. So she's like, you're okay. It'll come with time, but you know, there's certain things that I need you to be more aware of, and always be aware of your surroundings and your rooms and your patients, and know who's coming in, why they're coming in, and what they did when they were in the room, and like just always being attentive. And because of her, I feel like my multitasking skills have gotten way better. I feel like I prioritize what to do first now, and know how to navigate things, especially with doctors, and my confidence in speaking and asking them questions and things like that. So I am doing much better. I still have my tough days. I think everyone does, where you question like, why am I a nurse? Like, this is ghetto. I don't like this. This is horrible. And then there's days where you're like, wow, like this is great. So yeah, like it's definitely ups and downs, but I will continue to keep you guys updated, and I have a lot in store for you guys, so I'm excited about that. But if you haven't done so already, please hit that subscribe button. Join the Graceful Fam, hashtag Graceful Fam, if you've been here with me like literally since the beginning. I know there's people watching that have been with me since like my first NYU video, and I'm like so grateful for that. So let me know, hashtag that down below. Give this video a thumbs up, and I'll see you on my next one. And like I always say, if you're going to do anything at all, no matter how tough it is, make sure you do it gracefully. Bye.